Thank you so much for joining us today, Dr. Sneha. For those who have joined us, I'm Supriya from Momly. We are a community that brings together women at different stages and supports them through their motherhood journey. Today's session is with Dr. Sneha, where we are going to be talking about postpartum wellness, some tips and tricks, and also how to manage your physical and mental well-being post childbirth. About Dr. Sneha, she's a women health expert and a serial entrepreneur. She's the founder of the Birth Home and Fem First, and she comes with over 16 years of experience in this space. She's also a natural birth consultant with over 250 joys delivered. Thank you so much for joining us today, Dr. Sneha. Over to you.
Yeah, thank you so much, Supriya, for having me here. Postpartum has been very close to me because, I had my 2 daughters. I know pregnancy, think always that pregnancy is so difficult. We need to do a lot of things and prepare also. So these days I see that most of the parents are preparing themselves for the pregnancy journey, but postpartum comes with a shock because it's a journey which is very different than pregnancy, because pregnancy is something that you are taking care of yourself entirely and juggling between your home, maybe work, other stuff, doctors. But then once the baby is born, and it could be like first baby, second, third, like any baby, every time it brings the added responsibility, the added worry and stress, because this journey is lonely. In pregnancy, usually a woman has a lot of friends. She catches with her, girlfriends and go out and feels free to be just enjoying themselves. But then the moment they become mom, it gets difficult because this is a journey where she has to take by herself. And there are dads, more and more dads, which are coming up and want to understand and want to support their wives and the little one. But I think the tools are lacking completely, because as we are seeing with the things, with the information, the dads are wanting to support their wives, but at times they don't know how to. So that is something that still is lacking completely, and that's why we will be talking about postpartum, which is extremely crucial, and how to take care of yourself, what you may expect, what happens, and what are the simple things that you could do to bring that joys back to your life. So I'm going to share my screen now. Thank you, Supriya, for introducing Fem First. Fem First is my 3rd baby, other than my 2 real daughters. And I founded it in 2023, where I shifted gears from owning a natural birthing center to now promoting women's reproductive health from puberty till menopause. And pregnancy and postpartum is extremely special. So let's talk about 4th trimester. So I call postpartum not just a postpartum, but the 4th trimester. When she gives birth, everything changes. All the focus completely is on the little one. How is it doing? But I think we as a women should focus on women first, and then comes a baby. So what I say, jacha pehle bachcha baad mein. Because if we are able to take care of our own health, a woman's health, she will be able to take care of her family as well as the little one. So so I've divided this 4th trimester into 2 different changes, which is emotional and physical or bodily changes. So what do we see in emotions? We see there's a turmoil of hormones. The hormones which was progesterone, which was at the peak during pregnancy, now is going down. And there is rise in prolactin. And the hormones which were keeping her sanity, is not there anymore. It's a turmoil of changes that she sees in her body, and hence the postpartum blues, or we can also say depression, is very common. So there are multiple reasons behind it. Let's also talk about the reasons. One, definitely we talked about the hormones. Second is, a woman will never forget how was she treated during her birth, during her labor, and how she gave birth. And today we see the soaring high rate of C-section, which actually, it just shatters her likelihood or her chances, her wants to have a natural normal birth. That has also led to increased postpartum changes and postpartum depression. Earlier, it was said that the postpartum depression stays only for a year's time, but recent study says it is the lifetime changes. It is not just once, but once a baby is born, you can have a postpartum depression anytime in the life, which is very new and which is very true. A woman will never forget how she was treated till the last breath of her life. So that is one thing which has been very common talked about, but I still see there has been a deficiency or there has been a lack where a woman understands that she might need support, but she is not coming upfront. She is still, today at least she understands, she is aware that there is something wrong with her, but she doesn't know whom to go and she's very reluctant to take support. I think that is something we'll have to work more and more. I just want to say to all the moms here, either you are new moms or pregnant and going to have babies, please, there are few signs that you may see. One is all of a sudden you just feel like crying, or you feel like hurting yourself, or you can also feel like hurting your little one. You can start having the hatred feeling from the family. You just want to run away from all your responsibilities. You're not eating well, or at the extreme, you're just continuously eating. So these are just few signs. These are just yellow flags to show you that there is something wrong, and you need to take the right support at the right time. So that's number one, which I always want to focus here. Moms, please listen to me. If you are having these symptoms or signs, please make sure that you take a professional support, and we are there to support you always. Along with that, of course, it comes with an additional responsibility. We just discussed the way that women was being taken care during her entire pregnancy, and there's a shift of focus completely to a little man where she's like all confused, what's happening? Everything of her changes. There is her body changes, her breasts are leaking, she's having pains and aches everywhere, difficulty to even get up, do some basic movements. The house could be at it could be messy. I mean, it just comes with a responsibility, and that is something which is common, physiological. And I just want to say here that you are not alone in this journey. Every woman, I mean, including me, Supriya, Neha, everyone, we had a very similar journey where we found it difficult, and we always try to reach to the moms who can understand us much better, create a community. And I think that's what Momly, I'm really proud and glad that you started this community where, a woman can have the other shoulder to cry and just to talk about it, what's wrong, and how they can, support each other. Along with that, what is been happening is that postpartum is also a time where the woman has to pause her career. And this doesn't come easily to many women who are specifically career oriented and they really want to work. There are two things here. One is that she needs that rest. It's very important, crucial for her to at least take a break of 6 months, which is called as maternity break, and the organizations are offering the maternity break, and it is your right. Just in case if you don't know, that's your right to take that maternity break for 6 months. And at times, with minimal support or no support, at times she may have to quit her career for some time, which doesn't come easy. Once she was independent completely financially and she was working, everything was absolutely fine, and all of a sudden she feels like she's at home dependent on someone else's money. And this has been a very common complaint that I get through very often, and it gets difficult for a mom to get back to the work. I just want to add here, if you are comfortable, if you can get some support, if you have daycares around, because now the daycares are starting to take babies at 1 year of age. If that's something that you can do, you can start at least your part-time career is completely fine. Don't have that guilt. What if I go and a baby might need you? Because that baby needs you all the time. You also need to get time for yourself, for your growth, for your career, for your sanity, and there comes a changed relationship with her partner. Earlier there was a husband and a wife. Now there is a dad, a mom, and a child. That's it's very easy to say, but it's very difficult to find. Once you were going to movies or restaurants or dinner dates or anywhere, just randomly going. Now you have to plan everything upfront, and it will take many years for you to go back to that uh, to those time where you can just leave the home anytime. You might need a lot of planning, but that is doable. One thing here I want to say is that your partner remains the same, and there's one more little human being who has come to your world. So don't change your names to just mom and dad. You're still partner, you're still husband wife, and there's a little one who is there, and you both have to take care of that little child. But having said that, not on your personal relationships, that should not hurt. You should always try to find at least an hour during the day in that next 24 hours. Please make sure that you have at least some time with your husband. It could be just maybe having a cup of coffee, tea, watching a movie, stepping out for a walk. If your child is old enough and there's someone who can take care, you can go out, have dinner. Even with the baby, it's possible. Now there are a lot of places which are baby friendly. So please plan your day accordingly. One thing that I say to everyone is 30 minutes, date yourself. That means a self-care for 30 minutes where you are taking care of yourself no matter what. Even going to washroom at times is your dates, because you may not get that time. You may not have time to comb your hair or just take a bath. So just half an hour, feed your baby, let your family take care of your child, and then step back, go out for a walk, do something that you enjoy. Talk to your friend, talk to your mom. Anything that you feel will change your mood, will help you to fill your own cup. So there's and then the 30 minutes in a week time is for your husband. Try to find that time. It's extremely crucial for the relationship to build, because I have seen many families even breaking up because of not able to find time for each other. So please, moms, understand that it is important for you to maintain your own sanity, have self-care, and also have some time where you and your partner are there. And when I say that you are with each other, that doesn't mean that you are with your husband talking about how the baby behaved or how much the baby pooped or what the baby ate, but it is about you and him together. And then 30 minutes in a month or maybe an hour in a month is for your extended family, your mother-in-law, your mother, sister-in-law, anyone else. That is like once in a month I'm talking about. So the priority is yourself, then your husband, and then comes the extended family. The thing that I did, that comes with my personal experience, is questioning myself every moment. Am I the good mother? Am I doing good to my child? What if I'm not capable of doing anything to my baby? How to take care of that little one? I was never sure till my second child came in. Until I started reading, I got that understanding that I am the best mom in the world and nobody can replace me. I know my baby is more than anyone else. And please, mom, here to every one of you, you are the best mom for your babies, no matter what. And you cannot do anything wrong to them. So don't worry. Take a deep breath and just chill with the journey of your motherhood. It again, as I said, it comes with a lot of loneliness, but join a community where you can make friends. You can go for play dates now with your little one. You need a village to grow and thrive. Along with that, there are changes that we see in sexual life where there is a change in the sexual intimacy. Since you are breastfeeding, you may not be very wet, you may not feel comfortable, you may be tired all the time, or your husband may not be comfortable, starting the relationships back, like a physical intimacy back. But just simple hugs, maybe taking bath together, skin to skin with your husband, that's the great start to your life, because it is one of the things that produces oxytocin, releases endorphins, and just makes you happy. So please, I highly suggest to start at least building some kind of relationship, and we will be talking about all these things later as well. So now there are bodily changes. Someone who had a C-section will have sutures, or someone who had a vaginal birth may have an episiotomy sutures, which may be very uncomfortable, painful, which can prevent or restrict many movements. That is something that is what we also cater to, trying to prevent the adhesions, trying to make the things better for you. There's a weight gain in pregnancy, is supposed to be normal, but there's always a rush to reduce, to lose weight and go to pre-pregnancy stage. Most of the time it takes more than 9 months for you to go back to your pre-pregnancy shape, and at times you may not even go. That's also fine. Most important thing is that you feel better, your muscles are working fine, you have the strength, endurance, flexibility that is needed. At times women may have the mama paunch or a mama bear tummy, the paunch tummy, the tummy that comes out. In medical term, we call it diastasis recti, where there is a separation of the two part of the muscles that happens because during pregnancy the baby needed a whole lot of space, and it just pushed these two part of the muscles and crushed that ligament, which was there in between, the cartilage which was in between, and led to separation. Around 30-40% of the times it can recover easily. At times it may need a little exercise, but there are 30% of the chance that you would need an expert guidance to start your journey of postpartum fitness recovery per se. Because of your weak muscles, your regular continuous pains, aches, your joint might hurt. You may feel that you have less stability. You may have high chances of fall, which thanks to all the pregnancy hormones. There's one more thing that I have seen very often is that women have a lot of pain in the in the wrist, called as carpal tunnel syndrome, where you have all of a sudden numbness, especially at night. The wrist hurts, you're not able to lift your baby, you're not able to do certain activities. So that also is treatable, it is preventable. There are few things that can be done. And then there's always a slightly higher chances than the other women to have some kind of incontinence. Whenever you sneeze, cough, or you're not able to control your urine, and whenever you're just going to pass urine, you just feel a drop coming out. That's common, but not normal, right? So what we need to do here is, I don't know what's happening. Give me 1 second, sorry. So what are the key ingredients here? What you need to do is rest. Whenever, try to sleep whenever you have time. Forget about your house chores. The things can wait, but your sanity may not wait. You need to control, and you need to take a back step and rest as much as possible. Have a diet which you are taking in your pregnancy. Continue the same diet. Please don't stop eating or avoid good foods, because it is not about losing weight. It is about losing and gaining that healthy structure, healthy weight that is required. Because most of the time the women want to exclusively breastfeed. If you're not taking food properly, it will deficient your body. Your body will be at stake. So please ensure that you have a nutrient-rich diet. Drink a lot of water. There are few families where they restrict the water intake in the new moms. Please don't do that. Have enough water. Go for regular postpartum checks. It may be difficult to go with a little one, but it is important for your health, because at times there could be a risk, especially if you had a surgical interventions for your birth. So there is an increased risk. Make sure that you get yourself checked with your care provider as per the schedule. Get some time to bond with yourself, your baby, and your husband all together. Have patience and have that self-compassion for yourself. It's okay to say no. It's okay to ask for help. It's okay to just be on the bed all the time and just enjoy the warm cup of tea and a blanket along with your baby. It's okay to watch Netflix. It's completely fine to be yourself during those especially days when you are feeling low or you're feeling lonely. Communicate your needs. Communicate. That's very important. We always think that the other person should understand what do we want, but it is not always possible. We need to speak out. We need to open up with why are we wanting and what will change. How can we ask for help? again, I mean, during pregnancy, as we were discussing, that we are well prepared these days. Specifically, the women are well prepared, but they aren't prepared what to expect during postpartum. So read books, take professional support, you know, attend for few classes for the postpartum fitness, for the postpartum recovery. That's extremely crucial for your journey to come back, you know, healthy and fine. Since we were talking about the postpartum well-being, I have seen many women who wants to go back to a pre-pregnancy stage. Of course, everybody wants, but there are some people who are always in a hurry and they just start doing the things in a rush, hush, hush. Please avoid that. You need a proper assessment. As I said, there will be a high likelihood of you having that separated muscles called as diastasis recti. You need that initial assessment so that they can assess and tell you what exercises that you can start up with, because there are few things that you need not or should not do, but there are few things that you can do and have a gradual return to your activity levels. And as we're discussing about scar, it needs to be managed, because it can lead to adhesions, it can lead to organ dysfunctions, it can lead to pains, aches, postural problems, it can lead to many other things. I have seen incontinence raising because of the underlying sutures at which was present. So it's very common and we need to work on them sooner than later. Of course, like, why care? The question that I get asked often is that my mom also gave birth to us, but she never had this, you know, special individual treatment or a specific professional who were to support them. Let's talk about why they didn't need. The lifestyle has completely changed. Almost all of us have a sedentary lifestyle. We're working in front of system, or we aren't working the way they were, grinding chakis to, you know, working in the farms or doing a lot of household chores. There's an increased rates of C-section, more than 75% in first tier cities, specifically in the private setups. The nutrition have changed completely. They were eating the more organic food, and now the organic food is like extremely expensive. Not even, you know, at times possible for us to buy, because there are few foods which aren't organic at all. And our life has completely changed. The stress it comes along is very different. So these are the most important, crucial reasons where you should find a professional support. The reasons being is, you know, core strengthening, weight management, mood and mental health, because doing a physical activity will help you prevent those pains and aches, manage your diastasis recti if you have, manage any kind of core issues that you may have, to prevent it, stop it, and manage it to bring it to the pre-pregnancy stage. That's very important. Exercises also boost your energy, and doing that in a circle of friends will also create friends for life, and of course prevention of injuries as well. So here there are few exercises that you can start with without any worry. Once you are and we can talk about who can start. So like core strengthening exercises like single leg raises. If you see a woman doing a single leg raises while the other knee is bent, you can do repetitions of 10 to 12 and into 3 to 4 reps. You can do that wherever you have scar, either on your vaginal area or your belly. You can just do simple mobilization to start with, and then have a professional helping you with that. Doing simple pelvic tilt will help you gain back the strength for your core muscles, and it will also help to bring all the organs at place, because we know in pregnancy everything is just enlarged. Your uterus goes until the diaphragm, and it gets so difficult to bring back everything, and doing certain exercise so that the alignment is proper for your entire body is crucial. So these pelvic tilts will help you to bring back everything at place. Sideline leg lifts. You're just lying on your sides and lifting your leg on the sides, doing it for 7 to 8 times, 3 to 4 repetitions, a great start. Doing a simple deep breathing exercises where you're just doing a deep breathing, inhale deeply from your nose, exhaling for a longer time from your mouth is important for you. It will help you to bring back, help you to relax your body, Also helpful to, again, as I said, with the core muscles, with everything, all the circulatory exercises, these are important. Walking, starting with 15-20 minutes to gradually increasing until like 45 minutes for 5 days a week could be a great start for your exercises. And let's talk about now what are then don'ts. What you need not do is don't lift anything heavy more than your little one until at least 6 months. You have to take care of yourself even more if you had a C-section. Please don't do abdominal crunches until and unless you have got it assessed by the professional, by a physiotherapist. Don't do planks because it can lead to increased separation and increased issues then getting back to your, core muscles. Don't do intense workouts. Always start gradually, slowly, and then go up and increase your pace to do more intense activities. When to start? Once your doctor has given you a green signal that you can start your exercises, your bleeding should have stopped. You should not have continued bleeding. The bleeding after the postpartum, during the postpartum is called as lochia or lochia. So you should have stopped bleeding completely, and 6 weeks and beyond to start up with any activities. The benefits are it help you to gain the strength, flexibility, and endurance, which is extremely important, but that you might have lost during your pregnancy because of XYZ reasons. It also will help you improve posture because it's very common for a new mom to suffer, to have a lot of back aches and spinal problem, neck issues because of the way that she breastfeeds her baby more often, or had any intervention that led to prolonged pain. So we need to work on that, and the exercises will help you to reduce the pains and improve your posture. It definitely boosts your energy. That could be one of the best me times for yourself, where you are taking care of yourself and also spending the best possible time on yourself. It also speeds up your recovery time because usually it might take, as I said, the postpartum is just not like 6 months or a year. It can continue as long as we can take. So it's earlier you start, better is the recovery, lower chances to have any pains or aches, which could be related to any interventions that happen during your labor and birth. So start as soon as possible. It also helps you to restore balance and improve the stability, the stability, especially while you're doing certain activities, because now you need to hold your baby more often, and the baby will continue with. So you need that strength, you need that endurance to take your baby out, step out with them, and do all the activities rather than saying that, oh, because of XYZ I'm not able to do. Those should not be your excuses.
Great insights, Dr. Sneha. So I think quite interesting to know, especially about the part of not doing certain exercises postpartum, right? Because we're generally very eager to, I just assume crunches are like, the easiest way to reduce your tummy. So you just
See,
without thinking.
Many times, the women actually goes and hit the gym, and the gym instructors sadly they don't know what to do with those new moms. So that leads to even more trouble. I've seen women coming to me after doing months of gym and in an extremely bad shape, and that doesn't mean that your belly will be flat and you will not have diastasis recti, or it doesn't also mean that you may have a little fat on your abdominal muscles and you will have to have a separation. In both the cases, separation is not necessarily, it's not correlated. It's not correlated either with the bigger belly or a flat belly. It can be in any case.
You also have sessions, right? Like a 1 month session with the I think with postpartum mothers, or you can even do like a 2 month session and all of that, right? What are the key areas you cover in these mainly?
So it will cover everything that we discussed here today, even more. It will cover only strength building to endurance to diastasis recti management to pelvic rehabilitation to any pains, aches, posture, stability. I think everything is covered because everything comes as a package.
Thank you so much, Dr. Sneha, for your time. Thank you all for joining.
Thank you, everyone. Thank you, everyone, for joining. Thank you.